Okay, hello everyone and welcome. We'll go ahead now and begin. So welcome to today's session. This is Ellen Webb with the Center for Environmental Health. On behalf of the Center for Environmental Health and Reproductive Health Technologies Project, we welcome you all to the third session in the series. During this series, we have been focusing on topics related to resource extraction, energy production, and adverse reproductive and developmental health effects. We have been hearing from experts on everything from endocrine disruption and hormonal activity in water samples near drilling dense regions in the United States to the broad impacts of fossil fuels on children's development. Today, we will continue and hear from some new great participants. We will be discussing today the urban environment and how the urban environment can be affected by oil and gas production. And we will also be discussing the grassroots advocacy perspective about community efforts in reducing and preventing exposure as it relates to oil and gas. In a moment, I'm going to turn this over to Elizabeth Arndorfer, who will be our moderator today. But before I do so, I'd like to introduce Elizabeth. So Elizabeth Arndorfer is a consultant and longtime consultant with the Reproductive Health Technologies Project. For the past 11 years, Elizabeth has worked on a variety of projects with a particular focus on the impact of chemicals on reproductive health and fertility. She has a strong history as a public policy strategist and women's health advocate and has worked on issues from domestic and sexual violence to sexuality education. So Elizabeth, welcome. I'm going to unmute you and we can begin.
Great. Thank you so much, Ellen. For those of you who don't know the Reproductive Health Technologies Project, we're what many would consider a traditional reproductive health organization. We fight for all safe and effective reproductive health options, including access to abortion and contraception for all women, regardless of their ability to pay. We fight for better sex education so that men and women can have healthy relationships and make the best decisions for themselves. And we also fight for better chemical policy to reduce our exposure to toxics. We believe that reducing our exposure to harmful chemicals may be one of the most important things we can do to protect our reproductive health and the health of our families and communities. However, our experience is that too few people know or understand the risks that chemicals pose to reproductive health. But today's amazing speakers have thought long and hard about the connections between reproductive health and our chemical exposures, including the life cycle of energy development and production. I am very pleased to introduce our first speaker, Maya Nye. She is the Executive Director of People Concerned About Chemical Safety based in what is known as Chemical Valley, West Virginia. As an advocate for more than 20 years, Maya has won awards for her work and has testified before the U.S. Chemical Safety and Hazards Investigation Board and the EPA's National Environmental Justice Advisory Council. We asked her to present today because she spearheaded grassroots efforts to document women's experiences following the 2014 Freedom Industries Elk River chemical spill. In that work, she partnered with West Virginia's only statewide reproductive health and justice organization, West Virginia Free. Thanks so much for joining us, Maya, and for sharing your experiences.
Thank you so much. Can you hear me? Just want to make sure.
Yes.
Okay, great. Hi. Thank you so much, Elizabeth, for the introduction. Hopefully you can see my presentation. And I'm working from two computers here, so bear with me. But thanks again for the introduction. Again, my name is Maya Nye. I'm the Executive Director of People Concerned About Chemical Safety, located in West Virginia's Chemical Valley, as Elizabeth mentioned. People Concerned About Chemical Safety is an organization dedicated to the protection of health and safety of all of those who reside, work, and study in the vicinity of chemical facilities. And we promote environmental justice and chemical safety through education and advocacy. and we are affiliates with the Environmental Justice and Health Alliance for Chemical Policy Reform. We work with them nationally to work on chemical safety issues, supporting healthy, toxic-free communities where we live, work, play, pray, and go to school. And just a quick introduction about me is that I actually grew up in Chemical Valley, about 1.5 miles away from a chemical manufacturing facility that the company that my father worked for his entire career. So I'm quite passionate about these issues. So here, this is just a quick map of the Chemical Valley. It's about a 70-mile stretch of river, of the Kanawha River, that is home to multiple chemical facilities, primarily highly hazardous facilities. And you'll see a bulk concentration in the center of orange dots, and that's sort of where we are, where we're focused. It's about a 20-mile stretch of river, and if you'll see on the right-hand side of that map is the Elk River, and that is where the Elk River chemical spill took place. And we'll talk about that just a little bit more here in just a minute. Because what I want to do is just kind of tell you a little bit more about the history of Chemical Valley and let you know, we've had a number of incidents that have occurred in this valley throughout the years. Back in the 1940s, the government actually set up chemical manufacturing facilities in this area, used manufactured products for the war effort. So, that happened in the 1940s. There were a number of incidents that occurred between then and the 80s, but one of the really important moments to this valley was the Bhopal disaster in 1984. So if you don't know what that is, it was a chemical release at a Union Carbide facility in Bhopal, India, that killed thousands of people instantly and have caused long-term health effects for hundreds of thousands ever since. And that facility in Bhopal, India, was actually modeled after the facility that I grew up about 1.5 miles away from. And what we learned from the Bhopal disaster was that there were a number of reproductive health issues that occurred as a result of exposure to that chemical. So that incident is very near and dear to our heart and was very pinnacle. It was one of the reasons why our organization was formed. It was between that disaster and a leak that occurred 8 months after of aldecarb oxime that sent 100 people to the hospital that our organization formed. And actually, as a result of both of those incidents, the federal government implemented the Emergency Planning and Community Right to Know Act. So this is just a list of some other events that happened in 1993 when I was 16 years old. There was a pesticide unit blew up at that same facility. So a lot of what is manufactured here in the valley is actually primarily plastics and pesticides and other types of materials. Here are some other major incidents that occurred. The Bayer Crop Science facility that was the Union Carbide plant. There was a huge explosion at a pesticide manufacturing plant, killing a couple of workers. Leaks of additional chemicals over the years. Another worker died. But the one that we're going to focus on today is primarily the Elk River chemical spill. And excuse me as I transition a couple of different computer slides here. Let's see. We're actually not used to water impacts here in the Kanawha Valley. We're normally used to having impacts come through air. But let me find my notes here, excuse me. So again, this is the first time that we really had our water impacted. And one of the reasons for that is because the Kanawha River, the river on which we are situated, already is so polluted that it's not considered as a drinking water source. As you can see from this report, it was a 2012 Wasting Our Waterways report that indicates that the Kanawha River already has more developmental toxins dumped into it than just about any other river in the United States. And one of the things I think is interesting about this is that the Kanawha actually flows into the Ohio River, which is the 5th, which flows into the Mississippi River, which is the third highest ranked here. And then the Kanawha River has more reproductive toxins dumped into it than any other waterway. And again, with the Mississippi and Ohio just below that. So the reason why our community is using the Elk River is because the Kanawha River is already too polluted with these kinds of toxins to be able to utilize as a drinking water source. And the point source of this report was indicated to be the Bayer Crop Science Facility in Institute. And this is a picture from a historically black university right on the fence line of the Bayer Crop Science Facility. And what you're looking at is actually a coal-fired power plant. Most of the facilities in this valley manufacture their own energy. And you can see how close the community is here as well. I'm going to show you another slide that indicates where the Kanawha River is in relationship to this. And on the other side of that river is where I went to junior high school. So anyway, it's the toxins that have been dumped into this river, which is one of the reasons why we've been unable to utilize it as a drinking water source. That's one of the reasons why it really took us by surprise when the Elk River chemical spill occurred. The facility where it occurred is, again, in a tributary of the Kanawha River. It's a much smaller facility. It's not considered a highly hazardous facility. It's just a small tank farm. And so when the Elk River chemical spill occurred, it was on January 9th, 2014. It happened about a mile and a half upstream of the largest drinking water intake in West Virginia that served 300,000 plus people across 9 counties. And it was considered the largest chemical contamination of a drinking water system in U.S. history, though I know that there are some other incidents that it ranks closely to. And one of the important points of this is to say that the water plant did not shut down their intake when they learned that the chemical was leaking. So all of the chemical was taken into the water system and began to be distributed. And the chemical that spilled was a coal cleaning agent used in processing coal. This is not a very good graphic, but it's one of 62,000 chemicals that have been grandfathered in under the 1976 Toxic Substances Control Act that have not been required to have toxicity tests, toxicological tests prior to being on the market or in order to stay on the market. And again, it's a chemical that's used in cleaning debris from the coal before it goes off to be burnt to create energy. And this is a picture of the John Amos facility, which is just maybe 5 miles down the road from that Bayer plant. It's one of the largest coal-fired power plants in the United States. But one of the things that, so just to say, coal in West Virginia is it's probably the primary economic base of the state. And or at least in the southern part of the state. So chemicals are to our area as coal is to the southern part of West Virginia. So it provides it provides one of the only economic bases that we have. There's really not a lot of economic diversification in West Virginia. This particular incident really highlighted concerns around chemicals being used in energy development, or at least sort of alerted the people in this area to it. I will say that there are a number of people who already knew about this because unfortunately chemical contamination is not something new to the people of the coal fields of West Virginia. It was only up until recently that people in Printer, West Virginia got their water from wells. When people began getting sick, they traced contaminated water to the processing of coal and the chemicals being used in mountaintop removal mining. And following a 2012 settlement between Alpha Natural Resources and residents of Printer, the community was actually given access to Charleston's municipal water supply, only to have it tainted once again when the Elk River chemical spill occurred. And this is Maria Stewart Lambert. She lives in Printer, and she says that the smell the liquor smelling coming from the tap water recently was very much the same as the very sweet, stomach-sickening odor we endured 8 years ago. This is an image from, actually taken from Ohio Valley Environmental Coalition's sludge safety project. And it's just a list of chemicals that they've been able to identify in slurry and sludge from coal slurry ponds. And it's just the beginning of a larger list that has been very challenging for people in the community to identify what some of the chemicals are that they were exposed to in coal mining. And I know that we're talking about oil and gas mostly today, so I'll transition into that here a little bit later. I will say with this, though, that there was a recent study done that indicated high incidence of birth defects in communities where mountaintop removal mining occurred. But the connection, I'm not exactly sure about how the connection between the chemical exposure in the slurry and sludge, how much that was intersected with that study. So going back to the Elk River chemical spill, there was a do not use order that was put in place. People were told not to cook, bathe, drink, wash, not to do anything, not to use the water, period. And so this is a map from West Virginia American Water that they used to help people identify the areas where the ban was being lifted as they were flushing the chemical through each one of the individual residences. Oops, let me see. There we go. So after the water ban was lifted, it was actually reinstated for pregnant women. And this is actually a picture of my 9-month pregnant friend, Jennifer. She was 9 months pregnant when this occurred, and she resumed her normal use of water after the ban was lifted. Started drinking, started bathing, started using it to cook in, and then after that is when the ban was put back in place for pregnant women and children. And that ban actually lasted for over a month for pregnant women, and it was very unclear, actually, when the ban was lifted for them. So when this ban for pregnant women went in place, that's when West Virginia Free jumped into action. We had already been organizing around it, but that was one of the things that really galvanized their support because, as Elizabeth mentioned, they are the only statewide organization that really focuses on women's reproductive health. So they contracted me to host a series of listening sessions across the impacted area and to document the impacts of the spill. Because unfortunately, as I mentioned, because this chemical was not required to be tested prior to being on the market, there was no toxicological information that was available. So all of the questions that people had basically were unable to be answered. And most of those questions were, how am I going to be impacted? How will this impact my children if they're exposed to it for the rest of their, or for this short exposure, how will it impact them for the rest of their lives? Those were questions that we couldn't answer, so what we did was we documented them. And we worked with human impact partners. Their mission is to transform the policies and places people need to live healthy lives by increasing consideration of healthy and equity in decision making. So they helped us compile the report that we put out. And this is it. I'm going to go through some of the report findings with you. We called it Women in Water, Lessons from the Elk River Chemical Spill Listening Sessions. So between February and April 2014, just in the few months after the chemical spill, we held 7 listening sessions to hear directly from women and families. Some partners showed up as well, about how the spill impacted their lives, to find out what their questions were, what their concerns were, and then also the actions that they wanted to see taken moving forward. We had about 60 adults, 11 children who attended the listening sessions, and we had the sessions in churches, a couple of public housing complexes, and then once one of the things that occurred after the chemical spill was the disposal of the material, and it was disposed in a nearby county in a landfill, and people there also had the experience of smelling this licorice odor and were very concerned about what that meant to their community. So we held a listening session there as well. So some of the findings from this report is we found out that lives were just extremely interrupted. About 98% of the people stopped drinking the water, and only, as to the time of the report, only about half of them began using water to bathe in or wash. And some people actually traveled over an hour to bathe, and a number of people had trouble affording water on limited incomes. That was a major issue, and it was a big issue in the public housing complex areas that we visited. Physical health impacts were experienced. There were a number of experiences around having rashes, bumps, eye irritation, and a lot of the people who participated, they talked about going to the emergency room, either themselves or with family members because of exposure. And according to studies done by the local health department, along with a professor who, just after the chemical spill, brought his students from the University of Alabama to do some testing, Dr. Andrew Welton. The numbers that between those two, between the health department and between Dr. Welton, they identified that roughly 1 in 3 people experienced health impacts as a result of chemical exposure. Because again, all of the flushing of the chemical, every person had to flush it through their own home, so everyone was exposed to it. And they found that anywhere from 92,000 to 108,000 people all experienced health impacts, although maybe not all sought medical care. I know that I had a friend who had a previous lung issue, and when the chemical was flushed at her work, it actually exacerbated her lung condition and put her down and out. And so that was one of the things that when the CDC set a screening level to tell us what was an acceptable level of consumption, they didn't take into account inhalation. And so there were additional studies that were performed by a governor-initiated study called the West Virginia Testing Assessment Project that sort of reviewed what the CDC's interpretation of the data and what led them to determine this particular level would be okay for consumption. They determined that the CDC hadn't taken into account bottle-fed infants. And so therefore the CDC screening level was probably too high. So going back to some of the key findings of the report, fear and anxiety were pervasive. A number of people were very concerned about ongoing chemical contamination. The filters at the water plant hadn't been changed. So there was a lot of fear and anxiety about that. And there was a massive amount of decreased trust in government officials because of their handling of the spill and not acknowledging the fact that they didn't know when they wouldn't acknowledge when they didn't have the answers. So there was a serious lack of trust. Women and children at risk. This was a particular concern about pregnant women and children's safety and a desire to only have bottled water in schools. And then a number of the women who participated just agreed that civic action was absolutely needed. We needed to increase our engagement in order to demand change and to prevent future incidents like this from reoccurring. So out of this came some recommendations. And as a chemical safety group, an environmental justice group, we had already been working on some issues. So we were able to help connect people who were in these listening sessions to some of the work that we were doing as a mechanism by which we could prevent some of these kinds of issues from ever reoccurring. And so anyway, some of the recommendations that came out of this were to improve and increase monitoring activities and health studies, particularly for our most vulnerable populations being pregnant women, children, people who may not have had access to bottled water, who were drinking water or using it. That included mental health and monitoring. And one of the major issues is that there wasn't a real structure in place for our government to be able to compile all of this information. So this was a real ongoing issue, and is still an ongoing issue, of wanting to collect some of this information. And I'm running short on time, so I'm going to try to breeze through the rest of this. Prioritize addressing exposures in women and children. And because we were still in sort of the crisis, and people had such a serious distrust at the time this report went out, they wanted to continue seeing water distribution in schools and in public housing, and particularly to seniors and others with limited mobility. And they really wanted to see that there was a safe water supply and a backup system. That was one of the big problems, was that when water was taken into the drinking water supply system, there was no form of backup. So there's been a real push since this incident to make that happen. And then, like I said, we were able to sort of galvanize people around some of the chemical safety laws that we were already looking to try to improve, including the Toxic Substances Control Act and other laws. And then again, one of the recommendations that came out was to educate, organize, and mobilize the community around this issue. What's really interesting is that 300,000 people were impacted by a chemical spill, to whereas when chemical spills have occurred previously within our communities, it's primarily been people who live on the fence line of those facilities that have been impacted. And the people who live on the fence line are typically low-income communities or communities of color. So it was really interesting to see with the Elk River chemical spill, 300,000 people across a diaspora of race, of income levels, being impacted in the same way. This is the first time it kind of leveled the playing field in some ways. So as I said, we were able to utilize the community support that was documented in this report. We continue to use it today to push for a backup drinking water source. Recommendations that are outstanding from the United States Chemical Safety Board following another chemical incident that occurred a few years ago. At the state level, following this incident, we actually implemented an above-ground storage tank law, which most states don't have. There's not a federal law that requires above-ground storage tanks to be regulated. So we were able to get that in place. And the interesting thing about that is that a number of tanks that were impacted by that were oil and gas tanks. But because so many people were outraged, and because the legislative session was occurring when the incident happened, we were able to get this law put in place. But it's interesting, a year later, once you could no longer smell the chemical in your water and no longer taste it, and when a lot of the fear had somewhat dissipated, amendments were made to that above-ground storage tank law that pretty much completely exempted all oil and gas tanks across the state. I don't want to say all. It wasn't all. It was most. We were able to use this report as backup information for for reclassifying the Kanawha River to help ensure that less toxins were dumped into it, in order to help transition it to be able to use as a drinking water source sometime in the future. At a federal level, we've used this to help inform policy around the President's executive order on chemical facility safety and security. And again, with Toxic Substances Control Act reform. And we've also, this incident really helped inform disaster communication for these kinds of incidents across the country. West Virginia Free pulled together a Get Out the Vote campaign after this that was based on the data that came out of this report, and encouraging people to take action, get out and vote. If you want clean, safe water, you're going to have to vote, and you're going to have to vote the right people in. So that's one of the things that came out of this, and it was the Change the Current campaign. And these are just a couple of images from the campaign. And then we also use this the report in conjunction with this other report, Who's in Danger, Race, Poverty, and Chemical Disasters, to highlight how our most vulnerable populations experience chemical disasters. And this report primarily focuses on highly hazardous facilities, but coupled with the Women in Water report, it helps us look at other facilities that may not be considered hazardous, but that may still pose a high risk of health issues. So with all of this, I'll end in just saying that one of the things that I think is really, really important is looking at the supply chain, the energy supply chain, and how we're impacted from the beginning to the end. This is an image from the American Chemistry Council. With the sort of decline in coal in West Virginia, there's a real upsurge in the oil and gas industry. So as you see here at the beginning of the chain are natural gas sites, and the product is then transferred to cracker facilities. And there has been talk about siting a cracker facility here where the Bayer Crop Science facility is, and in another part of the state. And a lot of people are concerned, what would that look like? How would that impact us? Because based on experience of having all of these other kinds of facilities here, we know that the people who live on the fence line are going to have high rates of health concerns based on what is emitted from these facilities. So with the resurgence of the natural gas industry, a component of natural gas goes into making all of the products that you see here. So there's a real push for the natural gas industry to thrive here in West Virginia, because that means that would serve as the feedstock to help reinvigorate the chemical and plastics industry here, particularly in Chemical Valley and in other parts of the state. So that's just that's kind of a quick summation of what happened during the Elk River chemical spill, and how we look at energy development and how it's impacted reproductive health, or a lot of the questions that it's left around reproductive health issues. So with that, I will go ahead and just say I'm happy to take your questions.
Great. Thank you so much, Maya. It was really interesting, if not quite depressing. So I'm sure there are many people who have questions for Maya. You can put them into the chat box, or you can hold on to them until after we hear from our second speaker. So our second speaker today is Martha Arguello, and Martha is the Executive Director of Physicians for Social Responsibility, Los Angeles, and I am proud to say she's a new member of RHTP's Board of Directors. For the last 32 years, Martha has served in the nonprofit sector as an advocate, community organizer, and coalition builder. She joined Physicians for Social Responsibility in 1998 to launch their environmental health programs and became their executive director almost 8 years ago. As a coalition builder, Martha has emphasized the need for local grassroots advocacy, working in partnership with statewide policy actions. And consistent with that, she serves as the chair and steering committees of the Californians for a Healthy and Green Economy, Change, and Californians for Pesticide Reform. It's with great pleasure that I welcome Martha to share her experiences in this area.
Can you hear me?
Yes.
Wonderful. So good morning to the folks on the West Coast, and good afternoon to the folks who are on the East Coast. I'm going to tell you a little bit about how we ended up working around oil extraction in Los Angeles, and we come at it from a number of ways. Physicians for Social Responsibility Los Angeles is the Los Angeles chapter of a national organization. We're one of the largest chapters in the country, and our work in Los Angeles is very unique in that we address both global threats to environmental health posed by nuclear weapons and nuclear energy, and climate change, and also work at a local level with communities who are living in the fence line to polluting facilities, but also work in very deep partnership with communities around reducing health disparities related to environmental exposures. So we believe that uniting the powerful voice of communities with the credibility and passion of our physician members is an important part of being able to protect human health and the environment from nuclear threats and climate change. So as you see here, this is from an environmental health conference that we did in August of last year. We brought together a number of groups working in South LA, where this was one of the first times that there was an environmental health conference that linked issues around land use planning, green space, toxic chemical exposure, indoor air quality, and urban oil extraction. And we hosted this at the Holman Methodist Church, which is actually a few less than 100 feet from the Murphy oil drilling site. And so we work in communities that are deeply impacted by chemicals and by air pollution and this re-emerging threat of oil extraction. And in LA, everything old is new. This is one of my favorite places in Los Angeles. It's the La Brea Tar Pits. And so it shows us, we have fossil fuel friends in our past, and now there is sorry, I'm trying to navigate two computers as well. So this is one of the places I used to play as a kid, and they're still digging out some fossils. And of course, it reminds us just how much fossil fuel is under the ground in Los Angeles. So as of 2012, California was the nation's third most prolific oil-producing state, only behind Texas and North Dakota. In the last century, California's oil industry grew to be the #1 exporter in the state of California. So we have a long history of oil production. At the turn of the century, oil production in California continued to rise. In the 1900s, the state of California produced about 4 million barrels. In 1920, production had expanded to about 77 million barrels. Between 1920 and 1930, new oil fields across Southern California were discovered regularly in Huntington Beach, in Long Beach, in Santa Fe Springs, in Dominguez. And so we were a hotbed for oil production and was part of the economic boom of that time. And so this is what the photos that you're seeing now here. This is Huntington Beach. This is Huntington Beach today. And this is, again, I believe this is also near Echo Park. And so now we've got, so I want to give you a little bit of the history of the millionaires that were created in Los Angeles. So here is the California Queen of Oil. I was surprised to find her in our history. So she's Emma Summers, and she bought some of the first oil fields in the Los Angeles oil fields, and that's how she got her title. These are the oil fields that are actually in the neighborhood where I have grown up and lived most of my life, around Dodger Stadium and Pico Union areas of Los Angeles, and now Silver Lake, where I currently live. So she was able to create quite a fortune. Other folks who you may have heard of, so the Doheny fortune. Doheny ended up donating much of his property to the Archdiocese, and you'll hear a little later about what that actually, some of the interesting relationships between the Archdiocese and oil production in Los Angeles. So I don't know how many of you remember the show The Beverly Hillbillies, where there was actually an explorer named Clampett who they believe was the prototype for the Beverly Hillbillies, who also owned oil wells and oil fields in urban areas of Los Angeles. So here is a view from the 1920s. The arrow there, that's Belmont, the Campanile at Belmont High School, where I went to high school, and this is the Glendale Echo Park area. This is now highly, and there's Jed Clampett from the Beverly Hillbillies, and what you see here, those are some of his first oil wells, which are not far from Belmont. This is actually at the Echo Park Pool, where a number of my reproductive justice buddies and I actually go swimming. And so that whole area is riddled underneath with the oil extraction sort of the skeleton of that oil extraction and pipeline. And here are some of the trends. In 1980, we're at 100 million. And while this is declining, it's important to know what we are actually producing. Oh, I'm sorry. This is from Dogger. So this is as of December of 2014. So we produced about 24 million barrels of oil and then produced water at 798 million gallons. So we're still pretty high up there in production. So think back of those photos I showed you of the LA oil fields. This is what it looks like now. There is Belmont High School. There is there's a community park, which you sort of see the bottom of the park, and up here, right about up there, is where these oil fields are. And actually, I drive by there almost every day, and the other day, the pump jacks were moving again. And there's lots of housing, a park where kids play, the high school. There's actually capped oil wells underneath this football field now. And it is right less than a mile from the site of the Belmont Learning Center, which was nationally covered around Los Angeles' history of building high schools on top of toxic sites, including former oil sites, and schools that often share space with these oil sites. So there are those three sites. So here you start to see the extent of active oil and gas wells. This is from Dogger, so you can see the legend. I'll show you, there's Culver City. That's probably sort of around there. The Inglewood oil fields there. There's Culver City. There's certainly Torrance, and then all through Los Angeles, right through here, through East Los Angeles. That's Montebello, where there's a current fight right now. And then Santa Fe Springs also, where there's a current battle over expansion of oil extraction in Los Angeles. Again, more of these. Sort of we forget because we don't see them anymore. Again, more of the oil fields at Elysian Park, Dodger Stadium, and all throughout there are those wells. Again, more, so you can see the extent of what this looks like. And when you think of Los Angeles' population, this is, again, highly urban areas. This is one site many of you might have heard about. This is the Alanco Oil Facility, which is about a mile from the University of Southern California, next to Mount St. Mary's, which is a school primarily attended by young women. There's a high school. Here's the facility. Here's housing, very dense housing all throughout here. This is what some of these oil wells look like now. This is the painted with flowers. That's on the campus of Beverly Hills High School. That's another one that's hidden. This is the Murphy oil site. You don't really often know what's happening behind the high walls. This is a photo of the Inglewood oil fields, and this some of these photos are sort of surreal. Here you have a pump jack in Signal Hill in the parking lot of a McDonald's. And what we hear from the industry is there's nothing to worry about. We have been doing this practice safely in California for many years. We have been fracking in California safely for many years. Nothing to worry about. Well, that's, not so true. So here we have a long history of industrial incidents related to the extraction of oil. This one happened in 1985, and it was when the Ross Dress Burlesque exploded, and as you could see, 23 hurt. This actually led, to some changes in terms of underground digging. This was about the time they were building our limited subways, and so it went through the Fairfax area, which is not far from where the museum is, where the La Brea tar pits are. So that whole area, there's lots of methane, there's lots of oil underneath the ground, and so and again, while they say we have been doing this for years safely, the data actually doesn't bear that out. So this is a refinery fire that just happened very recently. this is, again, another refinery explosion that happened in February. This one was very interesting because many folks authorities were saying everything's fine, there isn't a problem, but you had folks in the vicinity with eye irritations, vomiting symptoms, which are symptoms of poisoning. So since sorry, I'm trying to catch up with my notes. So we've had many incidences of these over the years. This one happened in May of 2014. A pipeline broke. This is actually in Atwater Village, which is about 1.5 miles from where I live. And again, people said everything's fine, and then suddenly you had the health department saying, this is a really hot day. We should be worried about the fumes of the evaporating oil. Again, we've got incidents of accidents when we move fossil fuels. If you know Los Angeles, we have lots of traffic, lots of truck traffic on our roads, primarily using the Long Beach 710 freeway. Here is a photo of the City of Commerce, and that's all the burn and fire that you see from a tanker explosion. And this is what it looked like from the community's perspective, where the streets were on fire. And we had folks who live in this community actually come and testify when the federal government did their listening sessions on chemical security. And as I said earlier, we work on issues from a number of different ways, from the health perspective, from the local perspective on figuring out what ordinances we can do to protect communities that live next to fence lines, but also at the national level, we are also part of the Justice and Health Alliance, linking these accidents to efforts to strengthen our chemical security laws. And this actually happened yesterday. This was seen on the same 710 freeway, another tanker truck explosion with a big fire, causing terrible traffic yesterday and today. While that gets cleaned up, we still don't know what the health impacts of this will be, other than making LA's already bad air quality even worse. And then I'm going to talk a little bit about the chemicals that we have been finding that are used in these products. There's my toxic mind thinking of chemicals and products. So here are the chemicals that are being used. This is from a report done by the Center for Biological Diversity that PSRLA collaborated with, and it looked at dirty dozen of 12 chemicals that are currently being used, and these were reported through the South Coast Air Quality Management District. I'll go back to that. So here are the chemicals that are being used. I've circled the ones that are reproductive toxins, given that my work particularly focuses on the intersection of the environment, chemicals, and reproductive and developmental health. And so we know that these chemicals were used. This is how many times they were used. We see, again, a number of reproductive, mutagenic, and developmental chemicals that are being used in very close proximity to where people live. Less than 1,000 feet, for the most part, is where these chemicals are being used. And we know very little about the full range of health impacts that we're seeing on the ground. So we know that in California, they're doing acidization. It's a process where the combination of hydrochloric and other acids are mixed with brine and chemicals and injected into the ground. Once the surrounding rock is dissolved, the oil flows well and more freely. This has been done they've filed about 170 times by early June of 2013. Then there's gravel packing, and gravel packing is exactly what it sounds. You inject gravel with a chemical mixture into a well to form filters that help prevent the buildup of sand inside the well, and it minimizes sand buildup, increasing the flow of oil to the surface. And then there's the traditional, well, I shouldn't say traditional, but then there's what we normally call fracking, and the recovery method uses large amounts of water, sand, and chemicals, and they're injected into the wells. There's been about 11 of those incidents, the use of those in California. So in June, we acidized 35 wells, we gravel packed 22, and fracked 4. So you see the numbers there. Now I want to turn our attention to another area where we work on very extensively, and actually how we ended up working on this issue. That's Nancy Ibrahim, the Executive Director of Esperanza Community Housing Corporation. Our organizations had worked together for over 10 years. We provided training to their community health promoters on everything from pesticides to toxic chemicals in water, often doing it in the basement of a building that was actually next, right across the street from the Alanco Oil, never understanding why we had headaches and felt dizzy and did not quite feel well when we were, certainly I felt those impacts. So I get a call one afternoon and she says, you know, we do door-to-door work. They have a cadre of promotoras that are linked to a community health clinic, and they're working on reduction of lead and asthma hazards and other indoor air quality hazards in this community because they have very high rates of asthma. And through that, they discovered that there was a set of symptoms that folks were feeling, and in that picture, she's actually holding up wig heads that they very cleverly use to as a popular education tool to show the symptoms of illnesses. And again, these are promotoras, they're popular educators, so of course they would use the things that are in their community to talk about it. And you see the row of heads that show, you know, dizziness, nosebleeds, all the set of symptoms that folks are bleeding. And the stories were pretty dramatic, you know, of kids not being able to sleep at night because of their bloody noses, you know, multiple complaints about smells, gas smells. They are using these mystery masking agents that we still don't quite know what's in them, and I've been trying to find out for some time and keep getting the runaround. So the community would suddenly smell strawberry or guava smells, and we know that they were using chemical masking agents. We've not been able to find out what is in them. And so after, you know, this is a really inspiring story. They called me, said, let's figure out what's behind this wall. I'll show you pictures in a bit. We did a whole bunch of things. You know, we found out what was there. We did some training with community members on doing bucket brigade, air samplings, but we started meeting with the community. They created a coalition called People Not Pozos, which is People Not Wells. Pozo is the name for a well. And have, you know, been doing, again, door-to-door work, documenting symptoms. All of this came to a head 2 years ago when, at the time of the government shutdown, there was an LA Times article that talked about these health impacts. That was a very powerful article. Folks like Karen Bass, Congresswoman Karen Bass, who represents the area, Senator Barbara Boxer, all became very concerned and wrote letters to the EPA. The EPA came out to the site. They were overcome by the fumes and got sick, while the regulators who actually from the South Coast Air Quality Management District would come out and say everything's fine. They had, you know, the community did phone banks to call in, because you have to have 7 calls to actually come out in. It's debate 6 or 7 calls of a complaint for them to come out and investigate. So this went on for about 1.5 years, this back and forth, unresponsiveness. But when these articles came out, and unbeknownst to us, there was also, you know, a future assembly person who lived in the district who was complaining. All of these sort of came to a head, and there was a series of town halls with the South Coast Air Quality Management District that culminated in Alanco Oil actually voluntary shutting down, voluntary in quotes, shutting down. They're now they've been fined $99,000 over their toxic emissions. There's a current lawsuit, and there's been lots of retooling and improvements, but the community is saying this is just an incompatible land use. This is not compatible with community health. This is not compatible, oil extraction where children live, less than a block from a daycare facility, from a school for developmentally disabled children and adults. and housing of women of childbearing age who live next door at the dorms of the Mount St. Mary's College. And so the community does not want this reopened. We were hoping to see what happens as that community, that People Not Pozos, continues to fight. We fight on a number of levels, including really changing the land use zoning issues, and I'll talk a little bit later about that. But what's important to also note is that these oil extraction activities that have gone on in California for many years, and in Southern California since the 1900s, happen in a context, and that context is sort of what we call the social determinants of health. And what you're seeing here are the scores for Southern California. So there's Long Beach. Allen Coal Oil is right around in there. And these maps were produced by the state of California. They allow us to weight and to see which communities are the most polluted in the state of California. And as you see, that Southern California region all turns up red. And this, the CalEnviro screen uses a number of screening tools: air emissions, impaired water bodies, toxic releases, brownfield Superfund sites, but it also looks at linguistic isolation, income, access to health care, a whole range of issues that go into shaping our health. And what we found also from the Los Angeles Health Atlas, that these health disparities that you see on that map, that sort of living in those most contaminated communities, actually does have an impact. Here you have life expectancy at birth by community. And so you have, here's the West Adams Baldwin Hills, where you've got the Inglewood oil field, as well as the Murphy site and the Jefferson site, and probably the Allen Co site. So there you have average 75.6 years of life, but then you go to Bel Air, Brentwood, and the Palisades, and you have average life expectancy of 84.7 years. And so we know that place matters, and that the history of a place matters, and that these health disparities are now embedded and become, we know that folks living in Watts and Echo Park, Silver Lake, and Pico Union, also oil extraction communities. West Adams and Exposition Park, also oil extraction communities. Sorry, didn't mean to do that. Harbor, Gateway, Wilmington, also oil production communities. And I'm not saying that these health disparities are all related to oil, but that this resurgence of oil extraction is happening in communities already burdened with disproportionate health impacts, as well as living with disproportionate pollution in these communities. And so again, this is the CalEnviro screen. Again, the darker the color, the more the pollution. So there's Beverly Hills. There's some darker spots, and I would imagine that's from some of the oil extraction in Beverly Hills. Here's the Montebello area. You can barely see. I kind of know the city. There is the center of Los Angeles. And these maps are great tools for us to be able to look at pollution burden and make real decisions about what we should be doing to restore health and integrity in communities. And why this matters in terms of reproductive health, we continue to have very high rates of low birth weight. Those low birth weights are color-coded in this country, and certainly in Southern California. African American women have much higher rates of low birth weight and infant mortality, and not been able to fix that, and that is shameful. And when we start looking, sort of overlaying air quality and the role that oil extraction has in air quality, we need to do more research in understanding the role of oil extraction, freeways, and traffic in low birth weight and infant mortality, and understanding that who lives near those sites are mostly African American and Latina low-income women. Other issues. So the oil extraction happens, and it's overlaid, again, on health disparities. This is from the Los Angeles Health Access. We have these high rates. We've got hotspots of strokes in the same areas with oil extraction, heavy traffic, in all the sort of those the other urban environmental problems that we think about. There's also diabetes, again, the low birth weight, and asthma continues to be a major health threat in Los Angeles, and again, it is impacting more African American and Latino children in these urban areas. And so one of the issues that we need is we do need a lot more research connecting reproductive health and oil extraction. We need to understand the research that is emerging in other places and apply it to the Los Angeles context. Some of the hopeful things that we're seeing is that there is a growing number of women's health and health advocates who are deeply concerned with this issue, and we saw that reflected in our recent Reproductive Health and the Environment Conference, where we did have folks from the LA County Health Department talking to us, very interested in this, figuring out how we can do more of the research together. But one of the things that was incredibly heartening is when you have health officials, such as Cyrus Rangan, who's head of the poison control and epidemiology at the LA County, actually saying things like, you know, if you are following all the environmental rules and we clearly see that people are still getting sick, perhaps our current laws are not health protective. And that is something that we have been saying for a long time, that there needs to be a partnership between impacted communities and our local health departments, where our local health departments speak up and speak out about health. We can't reach our health goals of reducing health disparities if we do not address this oil infrastructure. So not only are we extracting oil every day, but the sort of range and number of incidents that occur at these chemical facilities, putting millions of people's health at risk, continue to be a problem. But we see these small openings where the health department is stepping up. We certainly saw the health department and the county step up recently in Los Angeles, dealing with a chronic and long-time lead emitter at Exide, where the county has actually created an environmental health strike team, and we're talking to them now about, you know, what other things that they want to look at. And we've heard that, you know, this issue of oil extraction and accidents are also things that they want to start to look at, because there's been a real failure at the state level to take this on. And then, you know, this again, because of who we are, we understand that there's intersections between climate, air quality, and oil production, and of course, chemical production. And we see that a lot in Los Angeles. Not only are we a center for oil production, we're also a center for chemical production, and many of those facilities have left a very toxic legacy and a very unsafe legacy. And many of us have seen this. We know that the oil, the Stone Age did not end because we ran out of stones, and the oil age won't end because we run out of oil. We need to begin to talk about how we create a path toward health and clean air and sustainable energy that allows, that protects communities in urban areas from these exposures. And I want to give you a brief update on where we are with a number of local policy initiatives. So certainly there's efforts at the City Council to pass a moratorium. There's also, and what's happened there is that we've had the language was introduced to City Council, and it was voted that calling on the Planning Department to develop language around moratorium. Since that's happened, we've had a number of actions by groups like Stand Los Angeles, which is working, uniting local communities where they're hosting oil extraction. The Planning Department has sent us a letter back to the City Council saying, we don't really have the expertise on managing oil and gas, so we need money to hire someone who understands oil and gas production, which all of us were sort of stunned by that statement, given Los Angeles histories of oil and gas production. That there isn't someone in the Planning Department with that kind of expertise is troubling. We've also now understand that the Western States Petroleum has threatened to sue the City of Los Angeles if they go forward, and so the city attorney has now sent, a letter to the City Council that WISPA has threatened to sue and sort of asking further action. So there's that body of work around the local city council is being managed by our general counsel, Angela Johnson-Mazzaros, and is working with, in deep collaboration with the coalition members of Stand LA. And then more recently, this effort to bring more women's health advocates to help around the research issues, but also begin linking it to our other area of work was around promoting chemical security. So that what the story that we're telling is it's not safe to pull it out of the ground, really is not safe to move it around in urban areas, and given our track record of poor operations at our refineries, this is not sustainable. How do we set a path towards sustainability? And through that, that work around sustainability and economic development, we work in South LA where we are having discussions about, what does economic development look like that actually benefits low-income communities? Certainly the fossil fuel industry, for its long history, has not improved the lives of low-income community residents, particularly African American and Latino communities. If you look at communities like Signal Hill, Inglewood, all of these other communities, or even Wilmington, they're still very poor communities. Where we work in South LA, there's 20% unemployment. The fossil fuel industry has not done that, and the expectation from communities is that we understand that it's really about creating a new economy, and that that justice and health is baked into it. So we're very excited to be part of the South Los Angeles Building Healthy Communities, where all of these things we're holding all these different elements from what's happening at the city to pushing around chemical security, and really finding what will Los Angeles economy look like if we place lifting the chronic unemployment and chronic disinvestment in communities. What will that look like? So we're excited to be part of this big movement in Los Angeles, and we're deeply connected through the state and nationally through these different alliances. And we'll right now, I think our next steps are just had an initial conversation with some folks at the county and want to follow up to see how they're going to address this oil extraction issue, not only in the city of Los Angeles, but in unincorporated areas in other parts of Los Angeles. So thank you, and I await your questions.
Great. Thank you, Martha. That was fascinating, both from the history perspective as well as from what is happening now. And I'm very pleased that you ended on a hopeful and really positive note. So that was fun to hear. So now is time for questions. And so while you can add your questions into the chat box, and while we are waiting for some of the questions to pop up, I will go ahead and start with some of my own questions. So I have a first question focused on Maya, although Martha, it would be interesting to get your take on it as well. So Maya, I was kind of struck by what you said about, immediately following the Elk River spill, people were very engaged. There was a high level of public concern. But then as time and sort of distance from that grew, perhaps the engagement decreased, even to such an extent that a law that you were able to get passed, additional amendments were made to it. So I'm wondering, as you're thinking about it now, whether you have any advice for people in other communities about how to take that, when a specific incident occurs like you had, how do you take that public concern and sustain it for the long-term systemic changes that we need to get in place?
Well, thanks for the question, and I think that that's something that, in all honesty, it's a constant struggle. There just from the 20 years that I've been engaged in this work and the lifetime of chemical disasters that I've experienced, that's what you see. You see a sort of a cycle of people's engagement. So I think that one of the things that has been helpful is that our organization has been there as sort of a consistent partner in the community where people can go to for information, can go to figure out how to engage. And what was really interesting, I think, with this particular experience, and it's probably one of the reasons why you engaged us in this webinar, is I think we really found new partners by looking at the reproductive health angle. It's not something that very specifically we focused on. It was embedded in the work that we did, but by sort of changing the conversation in a way, and it helped us focus a little bit more of the work that we've done to get people to look at it from a public health perspective in a way that perhaps they hadn't before. So I think just engaging new partners is something that other organizations can also do. And for us, it's been really helpful to connect with national groups doing this kind of work to help us show that we're not isolated, and this isn't just a one-time incident, and we're not alone. Other communities are dealing with this, so to help us problem solve and possibly work together towards change.
Thank you.
Yeah.
Martha, do you have anything to add?
No, but I think it's really fascinating. We had been doing this intersectional work around reproductive health and the environment for some time, really focused on our toxics work, and I think it's sort of interesting in prepping for this talk. I realized we had started off doing when we started doing the work, we really focused on this, the issue of the chemicals used in fracking and talking about fracking as fracking. And then through the work in our communities, we really, this is both conventional and unconventional oil extraction. And so I think having to do this talk has refocused me on looking at how we build those alliances and how do we not lose the opportunity created. We have this annual Reproductive Health and the Environment Conference. And the first year was really focused on toxics and pesticides, and last year we did climate, and this year we really made that conscious link between climate, chemicals, and air quality. And so we actually had folks from the communities come and talk about these. So we're doing sort of the legwork and the groundwork around mobilizing communities, but we also need to do the data. We have to collect the information so that it's based on real information. And I think, I love the idea of doing community health impact as well, because I think we need to see more of what's happening at the fence line.
Mm-hmm. How would you, and this is a question to both of you, but Martha, maybe you can start. How do you think it would be best to get that community level research?
Well, I think what's exciting is that communities like Esperanza that community has this rich infrastructure of nonprofit organizations focused on a whole range of issues who have traditionally not focused on the environment, and this has refocused them. So they have community health promoters who are trained on how to do door-to-door work, how to do interviews. So I think we have, some internal resources and capacity, but I would imagine, that working through the promotoras and through other networks, we could do some of those community surveys. And I am not actively engaged in the Stand LA campaign. That is my coworker, and so I can't tell you what their plans are, but I know that we're working with some interns now to do more lit searches and background searches to help inform more of those questions.
Mm-hmm. Great. And Maya, is there any ongoing research that is being done specifically as a follow-up to the Elk River spill, or any other ongoing research with the communities affected along the Elk River and the Kanawha River?
So there have been some studies in follow-up from that event, because the chemical that was released was not required to have didn't have toxicological data available, presenting a huge issue for public health responders to try to identify what do we tell people? When do we tell people this is safe? So as a result of the incident, the governor actually implemented the West Virginia Testing Assessment Project that did some toxicological testing, and then in follow-up, the National Institute for Health, I believe, is in the process of performing a study, and different universities got engaged. I believe that there was sort of a rapid grant provided through the National Science Foundation, so a few different universities got engaged and performed some tests. And we do know that some of those tests have shown that high levels of exposure to this crude MCHM compound indicated both reproductive and developmental effects in the animals that they were being tested on. It wasn't the same level that people were exposed to. It was a little bit higher. But so anyway, there are a number of tests that we really still need that may not be happening in order to help us even determine what is the risk at the site currently as we work on remediating that site. So, and I know that that's a real issue around, what do we do with the disposal of this material, because there's consideration that this material may be disposed of in municipal landfills because it's not identified as hazardous, yet we don't have the data that actually illustrates that it's safe either. Yeah. So there are some tests that are ongoing, and there are additional tests that are still needed. And in particular, just to kind of engage that question a little bit further, I know that around the oil and gas impacts, like on this webinar, I know that there's been a lot of focus around research right at the site of oil and gas extraction. And, because we're sort of at the beginning and the end of that feed chain, what we think would be helpful is looking at, so what would be emitted at a cracking facility, and what happens beyond the oil and gas site, what happens with the flowback and the brine and in the processing and disposal of that material, because we've also found out that recently there are a number of facilities here in the Kanawha Valley that are also processing this material once it comes away from the site and turning it into material that is then burned. And how does that affect all of the communities within that chain?
Mm-hmm. Yeah, it's the whole life cycle of the production and extraction and the movement.
Correct.
I think that makes a lot of sense. And I think some of Martha's very jarring photos spoke to that very thing as well. Martha, I have, so I just want to encourage people to put questions in the chat box. I have another question for Martha, and I just wanted to hear a little bit more about your efforts around the health department. And was that the Los Angeles County Health Department, or was that your state health department? And do you have any advice to other advocates about how to engage their health departments and how to get them as allies in this effort to, to learn about and hopefully prevent the negative health outcomes from this energy extraction business?
Yes. I will say we have not done nearly what we should have and the amount that we have. Given who we are, that we're physicians for social responsibility, we've not done enough. And I think, we've been asking ourselves, we've been sort of, as an organization, really focused on building our membership and building our physician base up again and really approaching things from a community organizing perspective and how you organize physicians. And so we've actually been engaging more physicians, and as we engage more physicians, some work for the health department, others work for Kaiser, others, and they're actually going on a tour of these sites in a couple weeks, and it's just our physician members. And so we've been asking ourselves, well, if we create this space where we're, again, sort of focused on our members and building our base of power, will our work be different? And so it might focus more on the health department because that's what our doctors know. And what I am finding, so that's all to say we've not done enough, we have not been intentional enough, but the things that we have done have sort of been, they've given us these aha moments. So the Reproductive Health and the Environment Conference, we actually do that with the Office of Women's Health for the LA County Health Department. And so we're creating these networks of relationships between women who are working in the environmental justice and environmental health movement and in the health department. Now we just have to be much more intentional about them. And so I talked about Dr. Cyrus Rangan sort of saying things publicly that those of us in the environmental justice community have been wanting a health official to say for 20 years. If people are still getting sick and you're saying that, you're following the rules, there might be something wrong with the rules. And so now we want to take that. We also know that the interim head of the health department actually came to our conference and stayed for the whole thing. 4 years, that's never happened. So we actually have a head of the public health department on his own, very interested. And there is a growing set of physicians throughout the state of California, in large part thanks to Dr. Linda Rudolph and others, who are, making the connection between climate and health. And we deeply know that we do not, you don't meet our climate crisis by pulling more fossil fuel out of the ground. And so how do we take all of that thinking and turn it into something? And I think that's what we're thinking about. So not a very good answer, but talk to me in a couple months, and hopefully we'll have better.
Can I respond to that as well? Oh, I'm sorry.
Yeah, that'd be great. Yes, please.
Well, we've actually, especially during the Elk River chemical spill, we were very successful in working with our local health department. Actually, Dr. Gupta, who was then the head of the Canal Charleston Health Department, was sort of our the one public official that people trusted, because he was one of the ones that would admit that he didn't know because he didn't have the scientific research, and he was one of the ones that was actually very much pushing to get the additional tests that we needed, and that in particular he needed, in order to be able to provide direction for how to protect the public health. So we were very happy to engage him around this issue, and he's actually moved on and is now the commissioner for the Bureau for Public Health. So he's now at the state level, and we're hopeful that he'll sort of continue that kind of work at the state level.
Mm-hmm.
Yeah, and that case really, the media coverage on that is worth looking at, because it laid bare this, ask your doctor if it's safe to drink the water, and the doctor saying, I don't know. And then people telling doctors, call the CDC. CDC doesn't know. So this huge, I think that incident really lifted up this problem for the health community of lack of information.
Mm-hmm. Yeah, definitely.
And unfortunately, the federal regulation that surrounded that, the Toxic Substances Control Act, even the current drafts, it's constantly being batted back and forth in Congress, and the current drafts of it right now still wouldn't prevent another issue like this from occurring, because it wouldn't make sure that we had the information that we needed. So,
yeah. Well, that's great. I want to invite Ellen to join and see if there are any additional questions for Maya or Martha.
Yes, hi, thank you. So there are a couple questions here. The first question is for Maya, and the question is, when the chemicals is used to clean coal, do you know what the makeup of substances removed from the coal is, and where is the wash solution disposed of? And do you know what the wash solution contains?
It's a really good question that communities have been trying to identify for a long time. There was the one slide that I put up from the Ohio Valley Environmental Coalition. They had a project called the Sludge Safety Project. It's actually, I'm not sure if it's still going on, but they were engaging scientists and community members to try to sample sample some of this material. And the list that I put on my PowerPoint had some of the chemical contents, but much like the fracking process, it varies based on whatever the mine is using. So where does it go once it washes the chemical? It goes into something called a slurry pond. And I know that in West Virginia there are a number of slurry ponds that are located on the tops of mountains. And there was one instance where a school was actually, after a community push, was actually relocated because if the sludge pound broke, it would have come down and wiped out the school. It would have come down off the hill and wiped out the school in the holler. So there are a lot of sludge ponds on top of mountains, or what used to be mountains, in West Virginia.
Great, thank you for answering that. So, and Martha, there's another question here for you, which is, do we know what year chemicals started to be used in extracting oil from the earth in LA County?
That's a really good question. You know what? I did not see that in my reading. Yeah, I don't know, actually. I know that what we hear from industry is that they've been safely doing it for over 40 years. And I also know that about 8 years ago is when they actually started, planning the fracking stuff, some test cases in Bakersfield and in Wilmington. So, some sort of, acidization, gravel packing, enhanced oil recovery has been happening for a while. But that said, I think when the oil industry says, we've been fracking safely for years, it's sort of like saying that, the Kitty Hawk is this, flying in the Kitty Hawk is the same as, flying in a jet of today. Yes, they're both flying substantially different.
Okay, thank you. And Maya, there's a question here about the person's a little confused about the laws you were talking about in terms of regulating above ground tanks in West Virginia. Can you just go over that a little bit?
So following the Elk River chemical spill, the legislature implemented a law to regulate above ground storage tanks, because previously there was no law that specifically looked at tank integrity, what the contents of above ground storage tanks, what they're storing, what is their proximity to a drinking water source. None of that was taken into consideration under law. And across the country, that's the same. There are very few states in the United States that actually have above ground storage tank laws. There are no federal laws regulating above ground storage tanks. So in the case of the Elk River chemical spill, this was a tank that was constructed in the 1920s or 30s, had been in continuous use, and storing multiple different kinds of chemicals. It was once like a diesel refinery or a processing facility, and became this storage facility. But in source water protection planning, there was no assessment of the fact that these tanks existed 1.5 miles upstream of the largest drinking water intake in West Virginia. So the law was implemented, and following the spill, within 2 months after the spill, that law was implemented, and it regulated primarily all tanks, all above ground storage tanks. And over the year, there was some chipping away at it. There were concerns. They were saying, oh, too many tanks are being regulated. Even milk is being regulated if you store it in these kinds of above ground tanks. So over the year, there was a lot of pressure, particularly by industry, to further exempt particularly oil and gas tanks, because they were the ones that were most heavily impacted. Because in the original law, process vessels, tanks that were considered process vessels, had already been exempted. So that exempted most of the chemical industry. So oil and gas ended up in this last session getting a bulk of their tanks removed and exempted from this bill. So, and a lot of what was discussed around that was that, oh, these tanks, they contain brine, which is always, when talked about publicly, it sounds like a very benign material, yet there's no real scientific data that actually shows us what this brine material is. And asked this in one of the past webinars, what is this brine? Is it the same as flowback? Is it different? And so there's not really a clear delineation, but industry considers that a lot of what is being contained in these tanks is safe, so that's why a number of them are now exempted.
Thank you.
There's no scientific data to show that. So.
Thank you for that. Martha, there's a question here asking, can you explain what water production means compared to oil production in Los Angeles?
That is not my area of expertise. So, no, I am sorry. I'm not even going to try to answer that.
No problem. All right. There's another question here actually mentioned. This is actually, I think, for both of you, perhaps, although I think it may be more directed towards Martha. I believe you talked about monitoring efforts.
Yes.
And so the question is, what do you recommend monitoring for?
Well, the community, so when we first started working on this, the community decided to work with the bucket brigades and do air monitoring. It wasn't as easy to detect, and so they've done less monitoring and are doing a lot more of door-to-door talking to residents and doing surveys. And we've worked with a toxicologist who helped identify surveys and work with the community. So I think that there's lots of tools to be used. The Bucket Brigade is one. There's several others. We've not done a lot of it, but there are some communities who want to engage in more. I know that there's one community group who's doing lots of amazing monitoring up in the oil fields near Culver City and near James Hans Park. They're doing everything from seismic monitoring. They're also doing infrared cameras to see methane leaks. So there's lots of tools that different community groups are using. We are not doing that monitoring.
Okay, thank you. And Maya, do you have anything you want to add to that?
We have not really done much community monitoring, and again, this is the first time that we actually, in this particular valley, had a case of drinking water contamination. I know in the coal fields they do, well monitoring. It's expensive though. The individuals can do it and submit it to. There are a couple of different research facilities that will test chemicals here, but and I know that there are some groups that were doing that, but I'm not sure how extensively that is done now. And, again, West Virginia is transitioning away from coal and moving more into natural gas. So the issues are changing here in West Virginia, and I'm not exactly sure what some of the gas communities are doing. Mm-hmm. We once did a bucket brigade as well, although we were unsuccessful in sort of pushing that and keeping that alive, because I think a lot of the people who are impacted by these chemical disasters, this isn't, the Elk River chemical spill wasn't their first disaster. It's like a lifetime of disasters, and kind of constantly having to deal with this. People just feel tired from it, and there wasn't a whole lot of energy around it. So
great, thank you. So we're actually going to wrap up now. We're past the hour, so we hope that everyone has benefited and learned some useful information from these sessions. We thank everyone for attending, and on behalf of CEH, I want to personally thank both Maya and Martha, and also Elizabeth, for all participating and doing a great job with this. We will be administering a final survey, so we'll be sending that out. So we urge people to respond to that survey so that we can continue to improve what we do. The recordings and the slides, people have asked for those. Those, I promise everyone that those are in the works, and those will be provided to you soon. I will let everyone know when those are available. And I just want to remind also people to remember to register for the future sessions. We have 2 more sessions, one which is going to be on Friday, May 8th, the same time. So instead of a Monday, it's going to be on Friday. And that's going to be talking about research approaches, challenges, and opportunities. And for those of you interested in hearing more about biomonitoring and monitoring efforts, we're going to have Dr. Harris, and he's going to be speaking about some of his research doing monitoring. So it'll be an opportunity to speak with some people more about that. And then we have the final session on webinar 5, which is translating science into policy. And that's going to be our final session concluding the series. And we'll be focusing mostly on talking about efforts from local efforts to the national federal efforts and what we can do to, in terms of next steps to take this to the next level. So that's it. So we want to thank everyone for participating. And again, please feel free to reach out to me or Elizabeth if you have any questions. And we hope to see you on Friday, May 8th for the next session. Thank you.
Thank you very much.
Bye, everyone. Thank you.